Welcome to the tutorial entitled Movements of the Lower Limb Joints. My name is Carlos Andres Suarez-Quian. I am the creator of this tutorial and I will narrate it for you. The objectives of this video are to describe the movements that occur in the lower limb joints. Let's begin. As you probably figured out long ago, even without gross anatomy, the lower limbs are responsible for two functions. They support our bodies and they allow us to exhibit locomotion or movement. Movement is joy, and without it we would have never survived the savannas of Africa. Movement of the lower limbs occurs at three joints. First, there is the hip, the articulation between the head of the femur and the acetabulum of the hip bone. Second, at the knee, the articulation of the distal femur with the tibia and between the patella and the femur. And third, at the ankle, where the distal tibia and fibula form a mortar joist type of joint with the talus. Review your bones if you have forgotten them already. In this video, I will only describe the actual actions of the movements. The muscles responsible for these actions will be presented elsewhere. Let's start with movements that occur at the hip joint. The hip joint is a ball and socket type of joint formed by the acetabulum of the hip bone and the head of the femur. It is the depth of the socket along with strong ligaments surrounding the head of the femur that help make this a rather stable joint. After all, the full weight of the upper body is transmitted to the femur at this joint. Three opposing types of actions occur at this joint: flexion and extension, abduction and adduction, and medial rotation and lateral rotation. Let's look at what they are. Here's the hip joint in the anatomical position. The head of the femur is set within the acetabulum and the neck of the femur extends laterally and downwards. We are now looking at the hip joint from the side. If one moves their thigh forward, as indicated in the image, this action is known as flexion. We flex our hips when we do crunches or take a step while steep mountain climbing. Also, when we're sitting down, the hip is in the flex position. If we now move the thigh in a posterior direction, this is known as extension. We extend our hips when we jump or when we stand from a sitting position. The powerful gluteus maximus is a principal muscle responsible for this action, and think of which athletes have a large gluteus maximus. Basketball athletes are characterized by having a powerful gluteus maximus. Let's go back and place the hip in the anatomical position. If we move the hip outwards from the anatomical position, this action is known as hip abduction. We alternate abducting our hips when we walk. What may not be clear to the beginning student is that it is the muscles of the contralateral hip that is raised when walking that are doing the work. If not, we would fall to the side. The opposite movement to abduction is adduction, when we move the thigh to the midline. Horseback riders develop strong hip adductors to stay on the saddle. The hip can also medially rotate, although this is mostly due to the movement of the femoral shaft. Think of trying to point your toes inward as if you were walking pigeon-toed. The femoral head glides during these movements. Clearing the soccer ball by a fullback from deep within their own side of the field would be an example of causing the hip to medially rotate. Medial rotation of the hip is not done by powerful muscles, and there is limited mechanical advantage for the muscles to perform medial rotation. Try doing this with your own hip. it is difficult to do for a non-athlete. Rotating the hip laterally is known as lateral rotation. There are 7 muscles responsible for this action, but 6 of them are quite small, and one of them, the gluteus maximus, does not have much mechanical advantage to perform the action. Hence, lateral rotation is not a major action of the hip unless you practice this activity. One type of athlete capable of extreme lateral rotation are ballerinas. First position in ballet, in which the heels of the feet touch each other along an 180-degree angle, is a principal example of lateral rotation of the hip. So to review, the following opposite actions occur at the hip: flexion and extension, abduction and adduction, medial and lateral rotation. Let's now focus on the knee. Surprising to most students is that the knee is the largest joint in the human body and certainly the most complex. Its stability is due in part to the ligaments of the knee, but mainly it is the tendons and muscles that surround the knee that stabilize it. Hence, this is the reason for strongly recommending physical activity in individuals to maintain a healthy knee joint. Here is a knee joint as seen from the side. Movement of the leg towards the thigh is referred to as flexion of the knee. An example of flexion of the knee is when we cock the leg to kick a ball. Flexion is also done when we run, and is accomplished by the hamstring muscles. The opposite action, bringing the knee to strike the ball, is extension, an action brought about principally by the quadriceps of the thigh. To beginning students, the description of the knee flexion relative to what is described as elbow flexion, the action of moving the forearm closer to the arm, at first appears to be somewhat arbitrary. Many students will argue that what is taught as knee extension should be labeled knee flexion. However, the rationale for this description is quite logical and is based on the definition of what flexion represents, the bringing together of 2 processes making up a joint, and the way that the limbs develop in the fetus. That what is described as knee flexion is similar to elbow flexion is clearly demonstrated in the slide. When we flex the knee, the leg is brought closer to the thigh, and when we flex the elbow, the forearm is brought closer to the arm. Thus, these actions meet our definition of flexion. As to why things occur as they do, however, we must turn to development, and the events are shown in this slide. Briefly, limb buds form in the developing fetus and project outwards from the body. At about week 8, the upper limbs rotate laterally, but the lower limbs rotate medially, until reaching 180 degrees in the newborn. Thus, the anterior part of the lower limb in the newborn now represents the posterior aspect of the developing limb bud, and when the knee flexes, it reproduces the same action as in the developing limb bud, exactly what is happening in the elbow. We now move to the final actions that occur at the knee joint, and that is medial and lateral rotations. But first, we need to examine the articulation surfaces of the femur and tibia, the condyles. Each surface has 2 condyles, a medial and a lateral one, but they vary significantly in their appearance. The condyles of the femur resemble broad, round tires. The condyles on the tibia resemble very shallow saucers on which the femoral condyles articulate. Also note that when the knee is fully flexed, there is limited articulation between the 2 sets of condyles. This is known as minimum congruence. As the leg begins the process of extension, greater congruence between the four condyles ensues. At the same time, due to the configuration of the rounded femoral condyles articulating with the saucer-shaped tibial condyles, the femur passively turns medially on the tibia. Thus, it is said that one form of medial rotation that occurs at the knee joint is a passive medial rotation, a rotation that occurs simply by the configuration of the four condyles making up the joint. Finally, maximal congruence is reached between the four condyles when full extension is reached. At this time, the broad area of the inferior aspects of the femoral condyle are in maximum contact with the tibial condyles. The knee is now locked in place and minimal muscle action is needed to maintain the knee locked while standing. Another event that occurs as part of this medial rotation mechanism is that the body's center of gravity becomes positioned along a line just anterior to the knee, indicated by the red arrow in the image on the right. As well, the full weight of the body is being transmitted down this path. When we discuss the anatomy of the knee, we will see that the ligaments of the knee become taut at this configuration, further helping to maintain the knee extended without having to recruit muscle action. The reverse action is lateral rotation. The unlocking of the knee is done by a small muscle, the popliteus. Once this unlocking occurs, additional muscles take over to modify the lateral rotation. Thus, lateral rotation is never passive. In addition to passive medial rotation, there is active medial rotation of the knee. This action can take place when the knee is already flexed and is accomplished by the hamstring muscles located on the back of the thigh. The range of motion, however, is not great. Active lateral rotation is identical as discussed previously and occurs in the flexed position. Of course, in the flexed position there is no need to unlock the knee that is already unlocked. To review, there is flexion and extension at the knee joint, as well as medial and lateral rotation. Medial rotation can be either passive or active, and lateral rotation will always be active. We now examine the actions that occur at the ankle joint. The ankle joint, too, is a hinge type of joint in which dorsiflexion and plantar flexion of the foot occurs. This action takes place between the distal portions of the tibia and fibula and the talus. Inversion and eversion occur between the talus and the calcaneus. Let's have a look at these actions now. When the foot moves towards the leg, this is known as dorsiflexion. The old terminology was extension, and the muscles that perform dorsiflexion are the extensors of the foot. If you find this concept confusing, go back to the explanation I provided of fetal rotation of the lower limb. As for knee flexion, the dorsum of the foot originally represented the posterior compartment in the anatomical position. A good example of dorsiflexion occurs every time we take a step. We dorsiflex our feet to clear the ground. The alternative is a well-known condition termed foot drop. We will discuss this in a later tutorial. The reverse action of dorsiflexion is plantar flexion. A good example illustrating this activity is when we jump, or when a ballerina dances en pointe. The foot acts as a lever to propel us upwards. The action of inversion takes place between the talus and the calcaneus. Inversion is defined as moving the sole of the foot towards a median plane. The reverse of inversion is eversion, or turning the foot outwards, away from the median plane. As you may have experienced already, extreme actions of inversion and eversion are pathological and result in ankle injuries, and regrettably are not uncommon in contact or jumping related sports. Finally, I should mention that movements do occur between the joints of the remaining bones that make up the feet, although I will not go into detail here. Suffices to mention that these joints allow more elegant movements of the feet as we traverse uneven or rough ground. It would be difficult to walk on an irregular surface if we had paddles for feet. As review, dorsiflexion and plantar flexion occur at the hinge joint of the ankle, whereas inversion and eversion take place at the subtalar joint of the ankle. This now concludes the tutorial on movements of the lower limb joints.